Good morning, everyone. I hope you're enjoying the SDS conference so far. My name is Dr. Brooke Ellison, and I'm from Stony Brook University. I'd like to thank Dr. Pamela Block for hosting this session this morning. Dr. Block is a colleague of mine, and she and I have been working very closely together on what we'd like to call the venture think tank. And the nature of my talk today will be on the think tank and the work that we've been doing and how it fits very seamlessly with the SDS conference's focus this year on sustainability. So in 2012, late 2012, the Northeast, as I'm sure many of you know, experienced a storm that was kind of unparalleled in its magnitude and its severity, Superstorm Sandy, which left most of the kind of the Northeast seaboard without power for a considerable amount of time. Now, this affected everybody's lives in the Northeast, but particularly those who depend on power for their very survival, really. And most notably, people who are on ventilators who require mechanical ventilation for their very survival. So, this population of ventilator users, or those who are vent dependent, were really particularly affected by this storm, by this prolonged power outage, and by the consequences and natural disaster that was very much the consequences of the storm. And this was the result of the lack of electricity that these members of this population require for their very survival. The inability to get the necessary medical services they need on a daily basis, and some of them actually ended up losing their lives as a result of this devastation. So because of these circumstances, it really kind of put a highlight on the needs of this particular population, of the vent-dependent population, in ways that really hadn't been seen before. Although people who are on vents face prolonged and persistent quality of life challenges, the consequences of Superstorm Sandy really demonstrated in what really perilous conditions they live, and how tenuous their lives can be on a daily basis. And as a result of this, colleagues at Stony Brook University and I founded what we call the Venture Think Tank, which is designed to provide technological and policy solutions to the lives of people who live on ventilators. And the impetus behind this really was the notion that medical technology has advanced in such a way that people who had once died as a result of different kinds of diseases and conditions were living longer lives, with their reliance on medical technology, but they weren't necessarily living fuller lives, and we wanted to try to change those circumstances. So the Venture Think Tank has as its its mission is a collaboration of the multidisciplinary experts from all different fields to try to create solutions for people who are on ventilators. That's really our centralized message and centralized mission, and we do this in various different ways. So, but before I talk about some of the issues and some of the initiatives that we've taken on, I'd like to talk to you just a bit about ventilator dependence and why this population has been so underserved for so long. So ventilator dependence is a consequence of many different diseases and conditions. It's not necessarily diagnosis specific. It's not a diagnosis in and of itself. And it affects people really of all different ages, all different backgrounds, all different geographical conditions, and from all different diagnoses. And when we were initially trying to embark on some of the work that we have since taken on, it's become very apparent to us that this population is of really an undetermined size and has been understudied and really underinvestigated and underserved in many different ways. So it's really the thing that unifies all these different people who are ventilator dependent is their kind of reliance on the medical technology and kind of an intimate experience with medical technology that both perpetuates their lives, but also kind of complicates their lives in very unique ways. So we've had many different issues and many different initiatives that we've tried to take on. We have goals of all different sorts, but probably maybe about a dozen different goals that we'd like to take on as an organization from all different perspectives, whether it's technology, whether it is matters of health policy, whether it is emergency response, which is particularly of importance to the nature of the conference this year, or really any other issue that affects members of this population. But in just our short history, not even 2 years of existence, we've focused on just several different things, which is the accessibility of technology, particularly emergency technology, living in the community as opposed to living in an institutionalized setting, which is certainly a major challenge for people who are on ventilators, improving quality of life, which can certainly be undermined in very, very pronounced ways for members of this population. And then most notably, which is really the area that we've focused the greatest amount of attention over these past 2 years, is in emergency response and making sure that the needs of this population are taken care of in the event of a natural disaster, just like Superstorm Sandy. So in just our short existence, we've developed a number of different partnerships, both within the Stony Brook University campus and outside of it. So some of the partnerships that we've developed are actually very much related to emergency response. So in just our short amount of time, we've established a partnership with FEMA, so the Federal Emergency Management Agency, so federal level emergency response agency, the American Red Cross, which has been very instrumental, especially here on Long Island, to try to alleviate some of the suffering that people have faced as a result of Superstorm Sandy. PSE&G, which is our local power provider, the United Way, which has worked very collaboratively with us to try to get a sense of what this population of ventilator-dependent individuals actually looks like, where they are, what kind of circumstances they face, what kinds of challenges they face. They've been instrumental in helping us to try to disaggregate this population and figure out where they are and their needs. The New York State Department of Health, because they've been very instrumental as well. They're doing a lot of work because there's been quite a bit of fallout and backlash in terms of the response to the Superstorm Sandy and the kind of the lack of attention that members of this population, as well as other special needs populations, were facing. So the New York State Department of Health has been very instrumental in trying to correct some of the flat-footedness and lack of response that was seen immediately following the storm. And then also at the federal level, the Center for Medicare and Medicaid Services, who are also trying to help us figure out what this population looks like, what their needs are, and where they are. And then within the Stony Brook campus, within particularly the School of Health Technology and Management, where both Dr. Block and I reside, we've developed a number of different partnerships, whether that is in the respiratory care department, the physical therapy department, the occupational therapy department, the Stony Brook University School of Engineering, the Center for Excellence in Wireless and Information Technology, the School of Dentistry or Dental Medicine, and the School of Medicine itself. So we've really branched out quite a bit to try to create a multifaceted and multidimensional approach to solving these really multifaceted, multidimensional problems that people face. So, immediately after Superstorm Sandy, it became very clear that the standard protocol that different agencies have put into place for people who are in unique medical conditions was really inadequate. So people like me and many others are on what the local power provider calls the critical care facilities list. So what this is people who face unique medical issues or challenges can apply to be on this, what they call the critical care list. And what this does is it provides the power companies with a list of people who might need additional services in the event of a power outage. Now, what they're very particular about is when your name is placed on this list, it doesn't guarantee any kind of expedited power restoration or anything like that. It just kind of gives them a sense of who is out there and what their needs might be. So the protocol that was put into place that's been in existence for quite a while is to have the power company issue a call to the member of the list, tell them that there's an impending storm, tell them to seek shelter outside of their home if they can do it, and then essentially to let them know that there's not going to be any guarantee of restoration of service in any speedy amount of time. And then kind of the last recommendation is to go to the hospital, go to the local hospital if you have experienced a long, prolonged power outage. And this protocol is problematic for many different reasons. It really creates the first line of defense with the power company rather than actual emergency response people, and that is most unfortunate. We need to have a system where the first line of defense is with emergency responders who actually have a sense of what needs to be done and what needs to be done, particularly in an emergency. So this protocol is really very it's inadequate in many different ways, and most notably, it puts people in very dangerous circumstances because the recommendation is to go to the local hospital, and in this set of circumstances is very dangerous, especially for people who are on ventilators, because it exposes them to pronounced infection. It takes them out of their most comfortable environment, which is their home, and kind of creates this situation of disadvantage when many other people can go to some other shelter. It doesn't provide that option for people who really need to be in a secure location. So as a result of the protocol that was initially put into place, we had issued, as an organization, the Venture think tank had issued a set of recommendations to the Moreland Commission, which was set up by Governor Andrew Cuomo to try to rectify some of the lack of responsiveness. And we had a series of recommendations. First and foremost was to keep ventilator users in their home as the first line of action in the event of a prolonged power outage. That was the safest, most secure, and most sustainable environment for members of this population to actually be in. It provides a comfort level that is very difficult to disrupt, and is really the safest. Assuming that there's no damage done to the structure in which they live, that's always the best and safest environment. The second course of action was that we had proposed was to allow members of this population to stay with your families and friends who lived in the community through the assistance of emergency responders who could help transport people to wherever they needed to go. And then the last was to create a set of Red Cross facilities within the hotels that people could actually stay in. People on ventilators could stay in that was equipped to meet their needs. And that was really common sense measures that would take out a lot of the uncertainty and risk and sense of fear that's often generated as a result of a prolonged power outage like we had seen after Superstorm Sandy, and we're certainly going to see on an increasing basis with increasing severity of storms in years to come. So in addition to that, kind of certainly taking off on the notion of sustainability, we've been working as an organization with engineers at Stony Brook University. So we have worked with them to develop technology that's already actually been in use for a number of years in countries that in Africa that don't necessarily have access to continual power sources. A series of solar panels to capture a certain amount of power and store them in batteries. And actually I have one that I'm using right here in my home that's being tested here in my home. we've been using it for I guess about 3 or 4 months now, since basically the dead of winter. So you can see in the picture that's provided, it was kind of in the winter when the picture was taken. So these solar panels capture the sunlight obviously and provide a backup power source for when the power goes down. And the thought process behind this is that in an event of a prolonged power outage, that fire departments could have 1 or 2 of these on hand and deliver them to people who need a continual power source. And it's being tested in my home, and so far it's been without any problems, and we're excited to see how this project is going to develop. And the last issue that we've been looking at is the ability to provide and to secure access to medical services, whether that is in the event of a power outage or in the event of a natural disaster or really any other time. So the thought process behind this project that we're working on right now is that people who are on ventilators very often need some kind of medical assistance on a daily basis, kind of on a continual basis, but at the same time, they don't necessarily have access to that, whether it's because of a lack of insurance or whether the insurance that they have doesn't pay for the kind of coverage that they need, whether it's nursing or whether that's just a home health assistant. And this puts people in a very precarious set of circumstances. It prevents them from being able to live in the community, which is always the most desirable place to live, and forces them sometimes to live in medical institutions or to seek care from family members. And this is very unfortunate. So this is an issue that we're also looking at to see what kind of coverage different insurance companies provide for their customers, and how much that's in alignment to the level of medical need. So all of these projects, which are all housed under the venture think tank, all kind of fit within this idea of sustainability, making sure that people have lives and circumstances that are actually sustainable moving forward, that they are in the safest environment when they need it after a natural disaster, that they have access to the medical care that they need, and that they can live within the community. That's really the kind of the take-home primary issue that we're looking to try to solve. And so far this work has been very well received, but most notably it's work that's never been done before, because this population's never been really looked at or studied or addressed in any concrete way. So I'll end there, and I know that Dr. Block is excited to take your questions. So thank you very much, and enjoy the rest of the conference.